The COVID virus became a litmus test to the governance system throughout the world. Wherever there is public health system is rampant or strong, they can tackle this kind of pandemic and infectious disease. Not only this, but also non-communicable lifestyle diseases also. Wherever privatization is complete, only a few people can afford the treatment. I also didn't intend to write a biography, but I want to write something about my grandma. I am thinking about that. I was thinking about that because she was a brave woman and she was an inspiration to me. And I thought to write about her experience and her stories. She was a very good storyteller. Story means about the previous history, about the feudalism and the atrocities faced by them during that period, and the struggle against the feudalism, the struggle led by the socialists and communists at that time against the untouchability, etc. And from that stories, we were all inspired, and I always thought about writing about her something, but I cannot during these days. And the next thing, the publishers, the Juggernaut publishers, Chiki Sarkar called me that she want to write a book on me, and it should have two parts. One is about my personal thing, and they add that word extraordinary. I'm not extraordinary woman, or in that book they add like that. I'm an ordinary woman and ordinary political worker, but I happen to be the health minister during that crisis period, 2016 to 20. Several natural calamities and pandemics occurred at that time, the floods and also the hurricane and also the Nipah and COVID viruses. Not only that, my government, under the leadership of Comrade Pinarayi Vijayan, started new missions also to develop Kerala as a new society, a scientific society. He started four missions, the Haritha Kerala mission, Life mission, and also Education Reform mission, and also Ardhra mission in health sector. And we had a very good project on that. We wanted to change the basic things and to improve the health sector according to the contemporary world. And I also want to write something about that also, but I have no proper diary script or like that, and I have to remember everything from my mind, and I have no time to write properly. At that time, the Jagannath publications called me, these books called me. Chiki Sarkar asked me that she want to write a book on these things. One part should be my this life and my earlier days, etc. How a girl from a poor situation, that is from countryside, a village, remote village, come to politics and become the Central Committee member of CPIM, the left party, and how I become minister and what was the experience. That way, they asked me to narrate the things. And I am giving my thanks to Manju Sara Rajan. Actually, she's the person who make this book, and they appointed Manju Sara Rajan, Jagannath Books, to come to me and hear me from these things. And I narrated everything. Sometimes I give simple manuscript written notes to her, and she collected it, and she not translated, but from my narration, he wrote everything. He recorded something and he wrote this book, and that become. I cannot say it is an autobiography because each and everything in my life is not added in that. So there is no need to mention that. That is not the only important part. I didn't anything my only because of my capacity, because it is the policy of the government, and under the leadership of the LDF, we were all doing new things in our own departments, and I worked hard in my department. That doesn't mean only I can do these things, And our party and our left democratic front decided to change all the ministers. It is not because the ministers are bad in their performance. No one were bad in their performance. Everyone worked hard and everyone performed well in the last ministry. But we decided that everyone should be fresh in the new ministry, except the leading person. And everyone was changed. No one is continuing there, not only me. And I am a communist, and I am a Communist Party Central Committee member. And both these activities, parliamentary activities and extra parliamentary activities, both are the same to us. The party taught us from the beginning itself that the person should work either in the party field or in the this parliamentary area. And no one can continue the parliamentary position for a long time. Sometimes they will get 2 times or 3 times, or newcomers will come at that place. There are so many leaders who even not contest in an election, but they are working for the society as party workers and party leaders. So there is no way to regret or no way to become disappointed on this decision. It is a decision, it is a collective decision, and we were not there. The old ministers were not there. But I was in assembly, I am an MLA now. I'm there and I'm doing my performance as MLA and also the party central committee member. That's enough. The COVID virus became a litmus test to the governance system throughout the world. Wherever there is public health system is rampant or strong, they can tackle this kind of pandemic and infectious disease. Not only this, but also non-communicable lifestyle diseases also. Wherever privatization is complete, only a few people can afford the treatment. They are only getting the treatment. What about the fate of the poor people? No one is reporting about that. Who is dying? Who is living? What is the condition of the poor people in the village? No one is reporting that. It is a dangerous situation, and privatization is a dangerous thing. Only we can allow private hospitals or very huge corporate hospitals, etc., because they can apply some technologies, they can buy some new technologies there, and we also can rely on that for some purpose. But for the poor people, we should arrange all these facilities in public sector. They are also human beings. So the the privatization is dangerous for the society, and COVID pandemic proved that. In USA, wealth is there, technology is there, but no proper public health system is not there. That is why they cannot contain the virus in the first part. Several persons died, out of thousands and thousands of people died in America. We cannot think that it is a well-built country because of this. They have wealth, proper wealth, wealthy country. But some places where there is Cuba, they have very good public health system, and they can manage somehow this deadly virus. In India, in Kerala, the public health system is strong. From 1957 onwards, we were building these public health institutions. In each and every panchayat, we have primary health centers, functioning primary health centers. That is the most important thing. Throughout India, our government tried to build some primary health centers, but in remote villages of the northern states, they were not functioning properly. That is why they become difficult to tackle the problem in their villages. But Kerala, it is there. Taluk hospitals, district level hospitals, and medical colleges. But when in front of the pandemic, we understood that it is not enough. So we tried to strengthen the infrastructure and capacities of our health system. Our slogan was to put the virus under the health system capacity threshold. We never allowed the virus to come up. Because of that, we increased the bed in isolation unit. when we increased the oxygen supply, we increase the production of oxygen before the demand increases, we pre-planned, we and produce oxygen sufficiently for we anticipated that sometimes the case may go to 25,000 or 50,000 in a day, and we planned for that. We increased the production of oxygen before that, so no one died in Kerala without getting oxygen. That is the difference, the pre-planning and also the people's planning. We can join, we can have collective activity, even the private sector. Some state health ministers called me and asked, Madam, how are you managing these private institutions? Here they are not obeying us. They are charging for the poor according to their wish, and they are not giving space for the COVID isolation ward and beds, nothing they are giving. And I said it is not like in Kerala. Even day before the spread of the virus, our chief minister called a meeting of the private hospital management, and I also participated in it. We asked them that you should left aside some space for the COVID, especially for COVID isolation ward. Case may increase in future. So you should set COVID isolation wards in your hospital. And some promised 200 beds, some 200 beds, some only 50 beds. Some small hospitals, they promised us to give 15 beds, etc. And we planned for that also. We work together, private and public system work together. That is because we have control over them. The major part or the controlling part is public sector, For the poor people, we have public health sector there. They cannot dominate. They are there in important private hospitals are there in Kerala. We are giving permission. We are not denying them. That is the difference, Who is controlling the health system? That is the question. We cannot allow the private sector to control it. Then we cannot give assistance to poor people, We cannot tackle the problem. That is the difference between Kerala and some other places.